one good thing about being at Seton, I definitely like that it's guaranteed, especially it can be stressful at the beginning of the year when you have to get a site by a certain date. So this is just a given, if you will. I like the diversity of Seton, the way you get to see a lot of different things, and it exposes you to fields you may have not considered. I learned how much techs do for the hospital. I had no idea that techs were a thing, and they are as important, if not more important, than a nurse. I was inspired by a tech in MedSurge, and her name was Megan. Shout out to her. And she helped the nurses maybe more than a normal tech. And I really just liked her work ethic. That's what inspired me. I didn't really have a bad moment at Seton, which I guess I'm lucky because did hear some other stories from people. So, yeah. I yes, I would say everyone at Seton was nice to me. I was pretty lucky with my experience, and they let me stay for the whole semester in one of the units. So, shout out to Cheryl, that charge nurse. I love her. Yes. Jenny, one of the nurses in the PACU, and honestly the whole PACU, but especially Jenny, she taught me how, like, their protocols in the PACU, which if you don't know what that is, the post anesthetic care unit. They're the people you hang out with after surgery when they're waking you up. Um, I learned a lot of things. Yeah. Nursing. At first I thought I wanted to go pre-med and become a doctor, but I realized that in hospitals they don't really do a lot of work. Not saying that they don't work, but nurses are the ones that are hands-on with the patients most of the time. So I realized that that probably wasn't the career for me and that nursing would be better. Yes, like I said, nursing is what I'm gonna go major in next year, and then I might do nurse practitioner, but I'm not sure yet. I definitely would like to go back to Seton. I loved the people there. I learned so much, and like I said, the exposure, it was great.
I got to try a bunch of new ones, and I think my favorite one was the anti-gravity treadmill. It was one of the machines that you could use when you were trying to get back to walking or running, and you get to put a harness on, and it basically just inflates. And it was really cool. There's a bunch of different levels based on how much weight you want to walk with, and I think that was my favorite one. I don't remember the name of this exercise, but I thought it was really cool because it has to do with like neck pain, where you like have a towel and you wrap it around like your back and you kind of just go back and forth. Yeah, it was really fun. And I also liked how I got to see multiple patients and they kept coming back and they would get better. And it was nice to see them graduate too because they have a whole entire graduation ceremony. So once you finish all of your exercises and everything, you get to ring a gong and you get a t-shirt and it was just really nice. I learned that it takes longer than usual and sometimes after you think you're healed, you can have like a setback and it'll take more time than you think it will, but you always make it. Physical therapy helps because you get a better understanding of your body and how different exercises can help different muscles. They were very helpful. It was really nice to get to know each person there, and I really liked the person who I was shadowing. She taught me a bunch of new things. And I even got to sit in on one of a different physical therapist like interview for a new patient, and that was really cool. I didn't really do hands-on stuff, but I did get to watch and it was still very fun. I liked learning new exercises. I think that was one of my favorite things because I didn't know there were that many out there. And so seeing people do those was really cool. Even I got to try them out. My physical therapist who I was shadowing helped me. I think it would be a very fun job, and I definitely have thought about it more and might go into it. My physical therapy place stood out more because I definitely saw more people there and talked to more patients than the other one, so it was just fun.
My favorite perk was that we got catered food almost every single day I was there, and the food was really good. I saw a lot of something that's called Barrett's esophagus, which is, in simple terms, just when stomach acid comes up into your esophagus and damages the tissue. Um, it's mainly a lot of medication orally, like pills, and it got very repetitive, it got very repetitive. Um, I didn't learn much about the medication or prescriptions, but I did get to write my first prescription for someone who was going overseas. So that was actually really cool. I got to handwrite that. It was very repetitive. It was a lot of the same issues that were presented in the patients, and it would be the same course of action, the same diagnosis, same, and I just was not a fan of that. It was a little weird talking about people having issue going to the bathroom, and it's not that I'm bothered by it, it's just not something I would want to do over and over and over again. We saw a lot of different types of patients. I don't know if this is against TIPA, but it was typically people with weight problems. Either they couldn't hold weight or they couldn't lose it. I saw not at Austin Gastro. When I was at Seton, I got to see four colonoscopies, which was cool. But that is something that Austin Gastro does. I just didn't get to see any. Um, I enjoyed the people there. I really like getting to know them and hear why they got into it. Yeah, that's something I enjoyed. I would not want to work in this field. It's not something that I'm passionate about. I don't really enjoy the day-to-day life, but I'm glad that there are people who like doing it.
I now think about my teeth more often, even if it's just like brushing and flossing. I try to take care of them like way more, even though I already did. But you know, there was dentist, dental hygienist, the dental assistant, and the front desk. I love the front desk lady. Me and her would always talk. Her name's Tina. There would be patients that would come in with like decaying teeth, and also when people have implants, it's kind of just like a weird thing to see because you see their gum and you see where the implant's supposed to screw in, and it's just kind of like weird because you like, normally there's a tooth there, but instead you have to like screw in the tooth. It was a bunch of the same things. My dentist would always see people who needed fills or needed a crown, and sometimes there would be like different people. Like one time, this guy came in and his teeth got hit with a baseball, and so they were like out of socket, and he had to like push them back in. And so that was really cool to see. Um, when people are getting their teeth drilled, you can smell the burning teeth, and it doesn't smell that good. Definitely, I try to take care of my teeth way more now because seeing that, I don't want to be back in the office. Maybe. I've thought about it more now after shadowing. I still am not like 100% on what I want to do, but I think it was really cool and I really liked it, so I might go into it. Well, you can't feel good if you don't really have like a nice smile, and like some people insecure of their smile. So by giving you like better dental hygiene, it could help you be more confident in life. Um, they had the drill, suction, toothbrush, obviously. And I thought this was so cool. They have like this like piece of string that they put around your gum and it makes it go down for when they're trying to take a mold of your teeth. So that was really cool. But apparently it has like a bad taste. It's supposed to taste bitter. Dentists have like a sweet tooth. They have a jar of like chocolate candies in their office. It's so funny. And they'd always have like crumble cookies too. Even Tina, like the front desk lady, said she used to have snacks up there, but if she didn't like them, the dentist would always end up eating all of them.
Oh my goodness. I have taken so many samples from Ladera Park. It's just something that a lot of the medical assistants do. And she has so many samples that it doesn't even matter. So we get to try those as a perk. I got to see excisions and a procedure called EDNC. It stands for electrodesiccation and curette. It's essentially, we call it a scrape and burn, and it's whenever someone has some sort of skin cancer, we use a curette, which is basically a sharp blade, and we scrape it away, and then we cauterize it. So that's something I got to see a lot. I got to help during one of the excisions. I used something they called the hooks to while she sutured, but um, that was one thing I got to do. And then I also prep for her procedures and if she's doing a biopsy, so I get to do a lot of helping Dr. Fiesel. It was scary at first. I, for some reason, felt like I was going to get sued, even though she wouldn't let me mess up or pull out the wrong things. But it was scary at first, but now I'm fairly comfortable with what I do. I got to learn a lot about how important sunscreen is. I feel like it's something that a lot of people leave out of their skincare routine, and seeing how many patients come in with some sort of skin cancer or what we call a precancer, which is not important, but it really, I think it was cool to just learn about that and just how simple it is, but how important it is. I love getting there and saying hi to everybody. Everybody there is so sweet. I never felt awkward or like I was just standing in a corner, which can be common at sites. Um, yeah, that my favorite part is honestly just being there. I love being there with everybody. I honestly, Dr. Fiesel. Dr. Fiesel is very social. She has great questions and a great memory. Like she will bring up things and ask me about how something's going that I told her months ago. Ooh, people say that cottery smells like bacon or like burnt something else. No, it just smells awful. I don't even know how to explain it. It smells awful. I am gonna work there starting in 2 weeks, so I'm very excited for that. Oh, I think my favorite memory was being at the hospital and one of the nurses mistaked me for a nursing student. So she had me do hands-on work and I didn't know how to tell her I wasn't one, so I just went along with it. The hardest thing I did, oh, this was more stressful, but during one of the procedures when Dr. Fiesel was stitching, I had to hold the hooks, but I had to hold it still. And I was very stressed because I didn't want to move and I thought I was gonna like tear the patient's skin and it was just very scary, but I got through it.
I learned that I like a smaller kind of environment instead of like the big hospital environment. It just felt more welcoming. I've been more open to dentistry and physical therapy. I thought they were like not in the picture before, but now I'm starting to consider them. I feel like it would be really fun to be in the ambulance and like rush out and like with like the stretcher. I feel like that'd be fun.
Um, I was very surprised about the workload difference at the hospital, especially from an outsider, I thought there was a whole lot more hands-on with the physicians where they do a whole lot more standing and prescribing in there for occasional checkups, whereas nurses are the ones constantly running around and helping patients. So that's something I learned.
Sometimes my dentist needed help with his comm lights, like when he knows to be called to a different area of the office. So I would press the exit button. That's what I did really well.
Dr. Fiesel definitely helped me the most. I had so many questions for her and she answered all of them. She also helped me find out um, what career would be the best for me because I knew what I wanted. I just don't think I knew what career would set me up for the life I wanted. Okay, so in the PACU, the post anesthetic care unit at the hospital, there was this one patient I was talking to. She was coming off of her anesthesia, and we were just chit chatting. And she looked at me and she was like, I know you're a drinker. And I didn't know what to say to that. I just stood there and nodded. So that was something funny that happened, and everybody in the hospital or in that room kind of just looked at me. So I would say just put yourself out there. There's a whole lot of things going on, especially at the hospital. Um, so you need to, one, be flexible, and then two, just be able to put yourself out there.
Don't procrastinate. I would try to get stuff done more quickly and reach out to more people.
I don't be afraid. I became more social towards the end and was willing to ask more questions. Just start off asking questions. One of the mottos that they have is learn one, do one, teach one. So I would just say if you get out there and you ask questions, no one's going to shoot you down. Oh, for sure. I would do it a second year if I could.
Yeah, me too.